Okay, we talked about all the benefits from the surgery, and then we talked about some complications. I don't like to talk about complications. It's depressing to think that some of you might suffer a complication of surgery, not losing enough weight, getting an ulcer, things like that. But now we're back on positive, so I like talking about this, so thank you very much. We talk about how we are likely to cure diabetes. Maybe 85% of our patients go from diabetic ahead of time to non-diabetic afterwards. And the other 15% improve, but their diabetes doesn't go away completely. We talk about osteoarthritis. Your osteoarthritis, your back pain, knee pain, ankle pain should get better. Okay? We talk about your breathing. Shortness of breath and sleep apnea should get better. Your high blood pressure, your high cholesterol. Okay? What about headaches? Well, we expect those have a good chance of getting better as well, and let me see if I can explain why. We talked to some of our patients today, and we heard that they've lost 5 or 10 pounds in the first week. Our average weight loss at 1 month is 30 pounds. Okay? And I'd like to ask you to think about it. 30 pounds of what?
Water.
30 pounds in the first month is mostly water loss. Now imagine in your mind that I took 30 pounds of water out of your ankles. Less swollen ankles, right? Imagine I took 30 pounds of water out of a swollen, painful knee joint. Oh, my knee doesn't hurt as much. What if I took 30 pounds of water out of your bloodstream? Your blood pressure would go down. Take 30 pounds of water out of your lungs. I can breathe better. There's not as much fluid in the lungs. If I take 30 pounds of water out of your sinuses, like I talked about, oftentimes allergies and stuffed up nose gets better. Now, let me tell you that your brain sits in the skull vault, the bony skull, and there is a pressure that we can measure called the intracranial pressure. And if you're obese, that intracranial pressure is elevated. And elevated intracranial pressure hurts. Imagine I took you over to the gas station and pumped in 20 pounds of extra pressure. Your head would hurt. That's why brain tumors present as headaches. They have increased intracranial pressure. After surgery, what do you think happens to a heavy person's intracranial pressure? Down. And with that, we often have permanent long-term relief of headaches. Way well.
Like, does that have with migraines too?
Well, a lot of migraines are migraines related to increased intracranial pressure. Is that cool?
Yes.
Yeah.
I have a question.
Okay.
What's typical for people who suffer from GERD?
Oh, GERD also, great question.